Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 114. A 72-year-old man complains of lower extremity edema, sensation of heaviness in the right subcostal area, dyspnea at rest. For over 25 years he has been suffering from COPD. Objectively: orthopnea, jugular venous distension, diffuse cyanosis, acrocyanosis. Barrel chest is observed. On percussion, there is a vesicular tympanitic, bandbox, resonance, sharply weakened vesicular respiration on both sides, moist crepitant crackles in the lower segments of the lungs. Heart sounds are weakened. The heart sound is accentuated over the pulmonary artery. The liver is +3 cm. What complicated the clinical course of COPD in this patient? A. Acute left ventricular failure. B. Chronic pulmonary heart. C. Community-acquired pneumonia. D. Pulmonary embolism. E. Diffuse pneumosclerosis. Chronic pulmonary heart disease happens when the right ventricle has to work too hard to pump blood to lungs that have been damaged. The lungs may have been damaged by a condition like chronic obstructive pulmonary disease, COPD, pulmonary embolism, or sleep apnea. As time goes by, the right ventricle may get weaker and not pump blood as well as normal. Over time, it can cause edema in the legs and other parts of the body, causing shortness of breath. Barrel chest is an increase in the anterior-posterior diameter of the chest wall resembling the shape of a barrel. It is most often associated with emphysema. Causes: increased compliance of the lungs leads to the accumulation of air pockets inside the thoracic cavity. Increased compliance of the lungs increases the intrathoracic pressure. This increase in pressure allows the chest wall to naturally expand outward. Lung compliance, C, is the change in volume, V, in the lungs for a given change in transpulmonary R. Transmural pressure, P. C equals V, P. Transmural pressure, PTM, is the difference between intrapleural pressure, PA, and alveolar pressure, PA. PTM equals PA. PA. Vesiculotympanitic resonance, bandbox resonance, wooden resonance, is a peculiar, partly tympanitic, partly vesicular sound, obtained on percussion in cases of pulmonary emphysema. The cardiac vibrations associated with the closure of the aortic and pulmonic valves produce the second heart sound, S2. It has the aortic component, A2, and the pulmonic component, P2. Both valves close at the end of ventricular systole. Normally, the aortic valve closes slightly ahead of the pulmonic valve. The closing pressure is higher in the aorta than in the pulmonary artery. Therefore, A2 usually occurs earlier and is louder than P2. Furthermore, A2 can be heard over the entire precordium, whereas P2 is usually auscultated over the pulmonic area. The answer is B. Chronic pulmonary heart.